Hello, everyone. Can everybody hear me? Yeah? Hi. Thank you, everybody, for staying after lunch. I hope you had a great lunch. And I wanted to welcome all of you to this panel. I wanted to start by introducing myself, Alejandro COLSA. I lead up the Breathe Cities initiative within C40. And Breathe Cities, it's a global initiative helping cities drastically reduce air pollution and protect public health. And we do that jointly between C40, the Clean Air Fund, and Bloomberg Philanthropies. And I'm very excited that we're here on the first day of London Climate Action Week with a session on tackling air pollution and health. More often than not, I find that air quality doesn't have the prominent spot in climate conferences as it should have, and I'm glad that we have it here today, and that I want to thank the club for really hosting us today and this incredible panel. And it's very important because air pollution and the climate crisis are heavily linked. They share many of the sources, they also share many of the solutions. But it really is health and the health and socioeconomic inequalities that put the human angle in the focus of all of our action. And we're going to hear today many of the stats on the negative health consequences of air pollution. And I think it's just important to understand that of all the things that are around climate action, sometimes air quality and cleaner action can be that first point of contact with communities that can really get them motivated to interact and to partake on the changes that are needed on the climate. So today we're here with an incredible panel that we're going to bring together the science, we're going to bring together the personal experience, philanthropy, city action, health data, to really understand how clean air, not just as an environmental issue, but also as a human right and a smart health investment. So we're going to start with a presentation by Professor ZONGBO. He's a professor of atmospheric biogeochemistry at the University of Birmingham. And then we'll join the rest of the panel, which we have Jane BURSTON, is the CEO of the Clean Air Fund, the leading global philanthropic effort to tackle air pollution through policy, data, and public engagement. We have MARINA ROMANELLO, the executive director of the Lancet Countdown. We have Agnes Agipong, founder and CEO of Global Child and Maternal Health. And we have Elliot Terhane, assistant director for connectivity, air quality, transport, and infrastructure, a big portfolio within the Greater London Authority. So we have this brilliant panel, but we want to start with a presentation for Professor ZONGBO.
Thank you very much. I'm ZONGBO from the University of Birmingham. So to start with, I'm saying, what is air pollution? I don't know how many people are very familiar with the air pollution. Two biggest air pollutants that worries us is particulate matter and nitrogen dioxide. So just think about the particulate matter. So the ones that really worry us the most is called PM 2.5. Those are the particles that are less than 2.5 micrometer. How small they are? The size of your hair is about 70 micrometer. So it's about 20, 30 times smaller than the diameter of your hair. So you cannot see them. However, they can get into our lungs. So the ones that worry us the most is called the PM 2.5 earlier. They can get into our lungs. And then the even smaller ones called PM 0.1 is particles that are less than 100 nanometer. They can break into the lungs and go anywhere in our body. So you can see from that figure, it can go into our brain. That's not helpful. That's not good for us. So how many particles we're breathing every breath? It's about 2.5 million particles. Think about it. We have to get rid of them. Even that's 10% of the deposit. We have to get rid of them. That's hard. It takes energy, takes our body to fight against them. So they're not good for us. Now, we all remember COVID. Everyone do. I'm pretty sure. 3 million premature deaths in 2020. But if we look at the health impact of air pollution globally, every year, it's about 7 million premature deaths. We have put so much effort, we worry so much about the COVID, but our emphasis or our energy hasn't been goes anywhere close to air pollution, even though that's a much bigger health problem. Now, I'm not saying COVID is not a big health problem. For the UK, the air pollution has air quality improved. So we're talking about 30,000 premature deaths every year now, which is good. It's reduced from 40,000 earlier. But the cost is £27 billion every single year. But air quality is not just for everyone. It's a big inequality issue. If you look at across the UK, the figures may be a bit complicated, but on a y-axis basis is the concentration, on the x-axis is basically deprivation. If you look at on the right side towards you will see that basically the more, the richer population has a lower concentration. The other side is the most poor also has relatively lower, that's mostly like rural areas. But the air pollution in the UK caused about 6 months reduction in life expectancy for, on average, on average for the whole population. However, that's not the same for everyone. For some people, that's 70 years. For the little girl called Ella Kissy Deborah, who tragically died in 2013, and the medical record have for the first time gave that contributory because of the air pollution. And she died when she was 9 years old. So it's not the same for everyone. But, we have made huge progress in improving air quality. And that brings huge health benefit. If we're looking at what London has been doing, the first ultra-low emission zone, look at one of our studies, recent studies, which hasn't been published yet, is the first phase of the illness has reduced nitrogen oxide substantially. If you look at in the center, the really green space. But that also have a benefit to outside London as well. How does that come? Because that policy had promoted people to change their behavior. That is, from my personal view, probably the most important impact. If you look at it globally, look at the figure on the right side, you'll see that over the time, the death attributable to air pollution has reduced substantially over time. And UK is one of the cleanest places in the world, but we still have a big pollution problems. The other thing I want to talk about is we are talking about climate here, so why air pollution is such an important thing here. Climate change and air pollution are same side, the two sides of the same coin. So a lot of the sources of air pollution and climate change are the same. So when we take climate actions, we're not only reducing carbon dioxide, we're also improving air quality, bringing health co-benefit. So this is a study by one of our colleagues, and you can see on the y-axis is the concentration, but over time, when we are taking climate actions, we are reducing air pollution, PM2.5 pollution. But one thing we also need to remember that, yes, we're going to improve air quality, we're going to improve health, but if we didn't do it properly, we could left those most vulnerable people behind and it become worse off. For example, when we make our homes more sealed to reduce energy consumptions, there is a possibility there are the most vulnerable, poorest population who will suffer because they don't have enough money to heat their homes. With the problem will be then they will have the potential indoor air pollution problem. So thank you very much for your attention, and this is a part of the research is funded by Wellcome Trust and also UKI and NHR. Thank you very much for your attention.
Thank you. Thank you, ZONGBO, for highlighting the urgency of the challenge that we're facing. Now would like to move into a section where we're going to ask questions to the panel. I think we're quite short on time, so I'm going to ask my panelists to keep it short and sweet, so that I want to make sure that we have 5 minutes for audience participation. But I want to start with you, Professor ZONGBO. Just to follow up from your presentation, you've talked about, data really can highlight a lot of the negative impacts, but also the positive stuff and the importance of equity. When it comes to the data that you've seen, what are some of the real wins that you might have seen following specific policies, and particularly in equity? How easy or hard it is to really be able to quantify improvements on the inequalities when you take bold action on air quality?
To answer your first question about what works, I mean, there are lots of examples across the world. The UK is a leader. And by phasing out the fossil fuels, we have substantially improved our air quality. That has been, proven elsewhere. But also there is a potential problem like the other solid fuels, like a wood burning, which is probably, from my point of view, is not that essential in terms of for heating, but they have a huge problem for the UK at the moment. In terms of how do we quantify the impact of those on the inequalities, we have to have the kind of data in a finer scale, and that data should be linked to the health impact as well, which is typically pretty hard to do. So you have health data, you have the environment data, they don't link, and then you can't really use them. I think there are ongoing efforts in trying to do that, but only when there is a wide access to such kind of data, we'll be able to better quantify the inequality impact, but also to quantify the benefit over time, how the air pollution decrease would have resulted in a better air quality and a health, and also reduced inequality.
Thank you. And Marina, maybe I'll jump now to you, linking to this. So there is, Professor ZONGBO was talking about the different types of data and how they talk to each other, might not talk to each other. From your point of view, from a public health system perspective, how do you feel is working, what it's working, and how do we feel that the health systems are treating this as the emergency that it is, based on the data that is coming out of incredible research such as the one from Professor ZONGBO?
Well, I think Professor ZONGBO made it very clear when he showed us the COVID graph, right? We're not really treating this as the huge health emergency that it is. We know that air pollution is one of the biggest factors of ill health and death globally. It's a silent killer. And because it's so quiet, because it's so silent, we struggle to respond to it. People don't just drop dead from air pollution. Right? People have chronic illness that overburden our health systems, that reduce our labor capacity, that deteriorate the quality of life, that increase the burden for care. And the full range, we generally measure it as the tip of the iceberg, right? We generally measure mortality, but mortality is really just a very small tip of the iceberg. The big problem with air pollution is the huge morbidity, is the huge impact that it has from young children to older adults throughout the whole life course. So we're not really addressing it with the urgency that we should, most definitely. There's also stories of success. As you mentioned, we estimate through our data that about 150,000 deaths were saved every year due to improvements in air quality, mostly because of reduction in the use of coal. So we have a lot of low-hanging fruits. We know that in urban centers, the biggest source of air pollution is generally road transport, and we know that shifting away from fossil fuel-based road transportation towards more sustainable forms of travel can not only reduce air pollution, but also make cities more livable, reduce traffic, improve people's quality of life and underlying health conditions by improving active travel, improving walking. So I think there's a need for a system change around particularly in our cities, to make sure that those cities are built around people's life quality, people's health and people's well-being, that we're not quite doing. So it's, I think, beyond the health system itself to all of the broader determinants of health.
Thank you. I feel there's a nice segue there with, from the health systems to then who are the health systems serving, which is the community, and what are the perceptions from the community about whether this is being done well or not. And Agnes, I'd like to ask you, many years you've been telling the story of how, from your own family experience, have you got engaged in advocacy for clean air. And I just wanted to gather from you, based on this experience, what do you think is missing at the moment of that link between a health system that is for the community and then the link with the policymakers that are then trying to, kind of walk around this very complex issue?
Yeah, so I think it's two. I think it's community engagement, and I think it's lived experience taking center stage. I'm not ashamed to say I'm the least likely clean air advocate. I always say, like, what am I, you're inviting me? And that's because it was just not a conversation that I had growing up around environment, around clean air. I'm born and raised in Southeast London. That's the only air I know. What's cleaner than the air I've been breathing all my life, right? But then my daughter got sick, and I kept on going back and forth to the doctors, and they kept on fobbing me off, and she kept on getting admitted into hospital. And in a very short period of time, between the age of 4 and 5, she was admitted finally, because I had to pick her up from school, with community-acquired pneumonia, which at that time was one of the leading causes of death of children 5 years and under. And at that time, I didn't know about, again, clean air, or I'm just a concerned mum for my daughter. And then as I start researching, I find out I live in the same borough as little Ella, that we kind of saw earlier. At that time, I was heavily pregnant, and I still am a maternal health advocate. And I was really shocked that, hold on a minute, even though I started off saying I'm one of the least likely, there's a black maternal health crisis happening at the moment in the UK, where, and I would say in America as well, where black women are nearly 4 times more likely to die in pregnancy, twice as likely to experience a stillbirth, and a whole host of other reproductive health issues. These things do not just happen when you rock up to the hospital. You don't just develop cardiovascular heart disease and so forth. So with what was happening with my daughter, coupled with what I was seeing in the work that I'm doing around black maternal health, I could directly see a link, but nobody was speaking in my language and speaking directly to us. So I developed an organisation, at that time was called Global Black Maternal Health, which was about putting research back into the hands of black communities as leaders and change agents, and looking at the engagement and actually speaking directly to black women who were either pregnant or had children 5 years and under, to understand what are their attitudes, what are their knowledge, and what is their behaviour around air pollution, so that at least then when we're looking at the data, we're saying, okay, then how do we communicate this message? But also, the families will tell you, right? There's a language. I know we spoke about kind of eco, earlier on, I forgot the other part, but we were speaking. That's not how I and anybody in my community would even engage, or because we don't have time to fragment these issues. We're dealing with a whole host of different issues within our community. So for me, it's really about then engaging the community, engaging in a way that the language is not exclusionary, right? And then building from there.
Mm-hmm. So we've talked about a little bit about the data and what we're seeing from the analysis that we're able to do. We're talking a little bit about the need for system change and the way that where we are approaching many of our public health interventions, but we also the need of engaging the community in the way that actually would help them mobilize and continue to support this work. So I want to now go into solutions-oriented and a bit highlighting the good stuff that is happening on the ground. And perhaps, Jane, if I can start with you, you've seen dozens of amazing examples through the amazing work that it's done through Clean Air Fund, through Rich Cities. Like, would you maybe share with the audience one or two of those, top of the class where you feel this has been done well and it has yielded these, positive co-benefits for both health and inequalities?
Yeah, absolutely. And we see a lot of mayors taking ambitious steps towards reducing air pollution, I think, because they're closest to the people, but it is never done without the data and without the community groups. It's always a partnership. So one example of huge amounts of success actually is Warsaw. Clean Air Fund has been working there since 2019, and we've seen over just a 3-year period air pollution reduced by 15%. So that is massive. It's also massive that they have measured it, and that's facilitated by some low-cost sensors that we launched with the Breathe Cities initiative. They've done two things. One is a ban on coal use for domestic heating. Everybody was using these stoves that they call smokers because they're so bad. They're just puffing out black smoke. And it was quite an interesting move because they banned them in the middle of the Ukraine war when everybody was very worried about energy security, which they still are. Poland is the second largest coal producer in Europe, so they feel like that coal is where they retreat to for energy security. But it was because of these health impacts that we've heard about that citizens were still getting out on the street and saying, we can't have this anymore. Our kids have asthma. The health impacts are too big. So the central region of Masovia banned coal-burning stoves. Warsaw started it off in October 2023, and then the rest of the region is going to copy in 2028. The second thing that they did was they've launched Eastern Europe's first low-emission zone for vehicles. Poland has some really old cars. I think at the time, the average age of a vehicle was 14 years. Actually now, interestingly, it's getting older as there's more clean initiatives in Western Europe and we're selling our cars to the east. But it's hard for them to put in bans because of European Commission and Union rules. But yeah, average age of the vehicles was 14 years. And what they found when we did a study on the actual exhaust emissions of the vehicles is that 6% of the cars were producing a third of the pollution. So a clean air zone is quite a good way of being restrictive just for a portion of the population with benefits for everybody and a real significant increase in clean air for the citizens. I think just to add before I finish, this isn't just a kind of developed country thing. Through this Breathe Cities initiative that you mentioned earlier, there's cities around the world that are starting to do the monitoring and the health impact studies that will set them on a path to cleaner air. And we just saw last week, I think it was, that Nairobi launched a low-cost sensor network of 50 sensors around the city. And the importance of the number is if you can have a sensor in lots of different neighborhoods, then you can see who's breathing the dirty air. It's not just 2 or 3 big kind of reference grade monitors on major junctions. It's in every neighborhood. And you can make the data available to citizens who want a campaign, like what is the pollution on my street? How might it be affecting my child? There's youth groups being mobilized around these African cities to then showcase the data to politicians to say, we want something to be done and can we be part of the solution?
Amazing. And yeah, there are all these cities that, for example, like from Breathe, have started to make this ambitious action that we're hoping it will, and we know it will, yield those results that we have seen in many other places. And I think moving on to, we're in London Climate Action Week, and we have an amazing guest, which is Elliot, who can speak about the incredible experience that London has had implementing very bold, ambitious, cleaner action. And Elliot, ULEZ and the overall package of air quality measures that London has put in place since 2016 is often cited as one of the key examples of how ambition can't yield those results. And from C40, a lot of our cities they look at London, and even though contextualizing that every city is different, they see it as when you put ambition to words to actual action, it could actually yield those results. But would you tell our audience, Elliot, from your experience, things that maybe you learned from the process that you would advise other cities so that we can really try to ensure that it's not just positive stuff, like there is also very difficult decisions and processes. So are there any learnings that you would highlight on what has been taking place in London in the last 8 years?
Yes, absolutely. And maybe just to echo a little bit what Jane was saying, is that we know that these tools that we're using, that these policies can be hugely impactful. And that's because we do have data. That's because, much like Jane was talking about Warsaw, we've also been a Breathe city. We set up a program called Breathe London, which built on a long program of air quality monitoring that we have done in the city since the mid-90s. So we've been able to track and understand some of the biggest sources of pollution in the city, and that has helped us design the approach that we've taken. So the ultra-low emission zone is probably the most well-known of those interventions, but there's also been work we've been doing around promoting walking and cycling, around switching vehicles to zero-emission vehicles, to cleaning up our bus and taxi fleets, and that package as a whole has been very, very important. And we've seen some really transformative and important impacts in London. So thanks to the ultra-low emission zone, we now think there's been about a 27% reduction in roadside nitrogen dioxide in the city, which again is a huge impact. But as Alejandro was saying, these things are not always easy to do, and we've got to be very mindful of the impacts that they can have. And one of the things that we were very keen to do when we were implementing the ultra-low emission zone was to think, how can we help people make the transition to cleaner vehicles? And that's why we introduced a scrappage scheme, which was designed to help people, if they need a vehicle, to scrap their old one and then be able to maybe get a new one. But a lot of people actually, thanks to the other improvements that we were making, actually were switching to walking, to cycling, and to public transport. And the investment that we've been making there has been very, very important. And I think for people to have confidence in, or to think that a scheme like the ULEZ is an appropriate one, it's really important that we're leading by example. And that is why we invested a lot of time and a lot of money in cleaning up our bus fleet and our taxi fleet. And it was interesting, again, Jane highlighted in the Warsaw experience, a very small number of vehicles were responsible for a very large amount of the pollution. And going back to 2016, our bus fleet of around 9,000 buses were responsible for about 20% of our NOx emissions. So again, that's why we really targeted and have focused improvements in our bus fleet. We now have the largest zero-emission bus fleet in Western Europe, with plans to go further and to have a fully zero-emission fleet by 2030. So it shows you what you can do, but you do need to take an holistic approach. You need to think about, I think Agnes's point was absolutely crucial, talking the language of the community, understand what's important to them, explain what you're doing, and we're still definitely learning. We are not there by any stretch of the imagination, but we are part of the reason we engage in groups like today is to be able to share and to learn our experiences.
Thank you, Elliot. And I think I'll take that point on data that you mentioned about Breathe London, and also Jane, how in Warsaw, by communities being aware and not stopping, they actually were able to get the kind of policy changes they were demanding. So Marina, from your point of view, are there other examples where maybe using data for building momentum and driving action, either where cities have got it right or maybe where cities have got it wrong and that others can learn?
Yeah, look, I think those examples were kind of quite phenomenal and quite representative. I come from Buenos Aires, that is a C40 city, where there has been a big restructuring of our city, our urban center, much of it around shifting away from fossil fuel-based transportation with enormous benefits to health, really, really substantial benefits to health. The public engagement has been horrendous. So to your point, I think you make a very crucial point, the public engagement, the benefits, and the consultations with the local population, I think there is where perhaps the data and the political action do not come together. So I do think that there's a lot more that we need to be doing about understanding. We know the data, we know the sources of emissions, we have very good data that tells us what emission is coming from where, what are the sectors where intervention is most needed. Now, implementing those interventions often affects people's lives, and that's where we have to be very careful about which type of data we're valuing, because it's not just about the hard data where the pollution is coming from, but also the data about how tackling that sector of pollution affects our lives. And I think there's a big gap in information and awareness.
Thank you. I think we talked a lot about cities, and cities. I'm from C40 cities, so I definitely always want to talk about cities. But sometimes cities definitely need the support from national governments, and we need national and international level action. Jane, zooming out a little bit on that, what do you think? Should national governments be doing now to ensure that cities are supported, and particularly when it comes to financing and investment, what should we be telling our national governments to do more of?
What should national governments do more? I think, devolve powers is one one option, because we do see city mayors the world over being the place where ambition is happening on climate action and air pollution. when we first set up the Clean Air Fund, one of the first grants that we did was with C40, and we were putting together a coalition of mayors to announce that they would be trying to meet these World Health Organization guideline limits to reduce pollution. And we set ourselves what we thought was an ambitious target of getting 10 mayors to sign up. We wrote the with the mayors, really quite stringent targets that they would be signing up to. And in the end, 37 signed up, and now I think we have 50 or more than 50. So it's where the action is happening, and I think they meet a lot of barriers to implementation because of lack of powers. So that is one thing. And then on finance, I mean, it is a particularly difficult time now to get clean air actions funded, less development aid, really restricted national budgets. There is a source of funding, though, that I think is a no-brainer, which is repurposing fossil fuel subsidies, something that would have to happen at a national level. But there's more than 7 trillion, I think, every year going to fossil fuel subsidies. The World Bank just came out a few months ago with the price of clean air, or at least halving air pollution by 2040. And it was half of that amount for the next 15 years. So the money is there, it's just going to the wrong place and actually making the problem worse.
Indeed. But I think we have a challenge with financing and getting the right money in the right places, but that's even more complicated when you actually add the inequality layer and the most vulnerable. So just maybe a dual question very quickly, like 30 seconds each for Elliot and Agnes. And when we're looking at how, using the little resources that we have, how can we make sure that we're doing it right, making the most value of our money to tackle those that need it the most vulnerable? What would you say that resources should be put into?
First of all, and I know this might sound contradictory, but it's not necessarily putting it into clean air in that kind of way. It's actually putting into the health impacts that the communities are actually experiencing and then working back. Because oftentimes, when we're talking about air quality and PM 2.5 and nitrogen, once you think you need to have a PhD to understand the task, it already kind of pushes people away. But if you talk about your health, the reason that you're at A&E consistently, the reason your child's taking time off of school, that resonates. So really about looking at those kind of groups that are already doing that work and then bringing in the conversation around how the environment plays a role.
Elliot?
And similarly, I think if you think about air quality and the impact that it has on deprived communities, one of the things that we've been able to do is really target some of our interventions. So I talked about the work we've done cleaning up our bus fleet. Initially, what we did was we designed low-emission bus zones where we could actually target areas with high levels of deprivation, high levels of exposure, and actually prioritise those new cleaner buses joining our network to actually go through those communities and in those neighbourhoods. And through policies like that and the work that we've been doing in schools, what we've actually been able to see, and ULEZ itself, of course, is that we've been able to halve the exposure gap between the least and the most deprived communities in London. So it shows you with the right kind of policies, you can actually make progress on this, and we want to go even further than that. But this goes to, I think, the wider discussion about needing to be able to get the right levels of investment, the right kinds of policies, the right kind of community buy-in to basically make sure that there is no gap in exposure to pollution because we've eradicated exposure altogether.
All right, I think we have probably 5 more minutes total for this, and I want to make sure that we opened not just questions from me, but also from the audience. So if I can maybe raise hands if you have a particular question for any of our speakers, and maybe we can take 2 questions at a time and see if we can get for a round 2. So there's a lady here in front, and there is a gentleman at the very back.
My question is, how do you reconcile the fact that air pollution reduces global warming? Like, heat increases when pollution improves.
And a second question, while you think about it.
Yeah.
Thank you. My question is about data. So we heard a lot about PM 2.5 data and other kinds of data. What about like human perceptions data? Or because PM 2.5 means very little to a lot of people, but what about like what people think about air pollution, and is that important for your work? Thank you.
Great. Should we start maybe, we know obviously Dieselgate doing something for climate turn out to be a complete disaster for air pollution? Are we taking into account all of those things to ensure that unintended consequences when it comes to global warming and others are taken into account? Anyone wants to take that one? Jane?
I can do the cooling question.
Yeah?
Yeah. Yes, so you're referring to sulfur dioxide, which for the non-climate scientists in the room is white particles and it reflects sunlight, and so it might be cooling, well, it is cooling the planet. I think that there are also scientists that think that the effect has been overstated. But either way, I would say two things. One, it's never emitted by itself. So it's often being emitted with carbon dioxide when you burn coal, or black carbon, which is black bits of stuff which are absorbing heat rather than reflecting it and re-emitting it into the atmosphere. And so you can't take the impact of sulfur dioxide by itself. And secondly, it's a funny argument when we're also that these people are making, not that I'm suggesting that you're making it, to stop reducing sulfur dioxide, when we're also talking about health. There are huge health implications to all of this, and it seems ridiculous to me that people would suggest that we want to keep on emitting certain kinds of toxic substances because they might be short-term cooling for the planet, A, when they're co-emitted with other things, and B, when they're so damaging for our health.
Right. Dr. Sommer, you want to talk about the data? The data question?
What question is that?
The one, how are we doing enough to take into account data for our
the perception data.
Yes.
I'm not the right person to answer that question.
I think no. We launched our Black Child Clean Air Report in 2023. Black Londoners in the UK are 3 times more likely to breathe illegal levels of air pollution. And I was shocked and astounded to find out that it was the first report from me, like, what's going on here? So that within itself, looking at that kind of particular populace, the fact that that's only kind of just happening there needs to be a lot more done around the engagement piece. Otherwise, it becomes an echo chamber of the same people that kind of understand the science talking to one another, and the community are then left behind.
And just to echo that, I think this is an area where we're still, as I say, trying to develop and improve the way we communicate and the way we explain concepts, and the way we also involve people in these kind of decisions. So that's something that, again, tools and partnerships like Breathe Cities are designed to bring people in at the kind of policy development and implementation phases.
Last 10 seconds, Marina?
Yeah, just to say that perceptions are the core of whether we will do or not the transition. It's not a technical problem. It's only a political problem. It's only a problem of political and personal will. So looking at perceptions is basically at the core of it. We have one of our 5 working groups is focused on perceptions. And encouragingly, what we do find is that when we put health at the center of the climate conversation, then the appetite for climate action grows quite significantly. And we always talk about the health co-benefits of climate action, but we never talk about the climate co-benefits of health action. So we could just not talk about climate change, keep on talking about air pollution and tackling air pollution. And back to the other point, end-of-pipe control, so control measures that reduce air pollution without tackling climate change, achieve very little. If we do both of them together, we have enormous benefits both to climate and to the environment. So we have to start putting health at the center of all conversations.
Perfect. Well, thank you so much. I want to thank everybody in the panel for your time in such an important first day of London Climate Action Week. We've talked a lot about different aspects of the action that is needed on the ground. We talk about the need for systems change and really make sure that we're going for the low-hanging fruit first, because there's a lot of action that can have immediate effect. We're talking about data and how data needs to talk to each other, but it also needs to talk to the people and engage the communities to make sure that it's resonating to the conversations that people are having at home. And we need governments to empower cities to do the things that city can do well, whether it's through more devolution, whether it's more funding from the institutions. So I hope that this was, even though there's a lot of always negative, the negative consequences of air pollution that we all know, but I was in a session earlier today that things are negative until you turn them in positive. So everything that is a health negative consequence, it can be a gain if we actually take action now and we're able to quantify it. So I hope this is inspiring, and it's the first day of London Climate Action Week. We have a week full of events. Make sure that you join up to the conversations. And thank you all of you for your time today.